Your choices. Which of the following medication is most likely decreased in efficacy in the presence of omeprazole? Would it be warfarin, phenytoin, alprazolam, clopidogrel, or heparin? Tell me. Doing good, already 6 answers, but there's 27 of us right now. 10. Have a big swig of coffee and then jump in the pool. 15. We can do better. Give me more than 15. All right, so here the little trick is what? What do you think was tricky in that question? Let me show you at least 18 of us and what we answered. You told me a little earlier on, omeprazole does what to P450s? What did we say together with the clarithromycin? We said omeprazole is as a proton pump inhibitor. It inhibits P450s. In particular 2C9, 19. 2C9, 2C19. And that's true not only of omeprazole, but you know, lansoprazole, esomeprazole, these are very classic as azole compounds to block P450. Now, when you look at warfarin, the anticoagulant warfarin, you've got to tell me, normally warfarin is metabolized by which enzyme primarily? Do you know that? You know warfarin, right? The anticoagulant? It's actually metabolized by 2C9, 2C19. That's right, Zaya. But if you use an inhibitor, would it decrease or would it increase the efficacy of warfarin? Is warfarin a prodrug or is warfarin acting as it is, as an anticoagulant? Exactly, Sam. It would increase it. So I know it was your favorite answer, but I tricked you. Is that okay? So here, inhibiting its metabolism would increase its effect, and the patient would have bleeding type of issue. Is that okay? Phenytoin, same thing. Phenytoin inhibiting its metabolism causes it to build up. And if it causes it to build up, that means, if anything, increased CNS depression. What do we use phenytoin for? I don't think you've done much of a CNS yet, but I'm sure you know phenytoin, right? For seizures, absolutely. So that's an anti-epileptic. It's actually a sodium channel blocker. So it works on the electrical activity of those cortical neurons that depolarize in epilepsy. Same for alprazolam. Same, and that's a benzo. So same story here. Now, I tell you who it's not gonna be. It cannot be heparin. One of us wanted heparin. That's an anticoagulant. This is not metabolized by P450s. Anyone knows how heparin is metabolized? It's quite interesting. No? You know, it's a large sugar. And as a large sugar, heparin, it's actually removed by splenic macrophages. So it's an unusual metabolism. It's the drug clopidogrel. So I have 6 of us who answered. Sam, I hope you answered clopidogrel too, huh? What is clopidogrel? What does it do for a living? Anyone can remind us? And hopefully like this, we've put our finger on that first half hour together, that if there's something important about anti-ulcer drugs, it's drug interactions. Guys, they are the favorite group of drugs for drug interaction. Between messing up the pH, that's virtually true of all of them, they raise the pH, and some of the 2 major classes, first and second line, having an effect on P450, then you know you're going to have an issue with drug interaction with those medications. Sam, it's an antiplatelet. And as an antiplatelet, it's actually a purine receptor antagonist, a P2Y12 antagonist. Therefore, something that would raise cyclic AMP in a platelet to being activated and then aggregating. The problem with clopidogrel is this is a prodrug. And when you call it a prodrug, it means it's inactive until, thanks to 2C19, it becomes the active metabolite. So, of course, inhibiting this with a proton pump inhibitor decreases the efficacy of the antiplatelet drug. And you see, one of the big, maybe someone ended up taking antiplatelet instead of aspirin. And guess what is a common reason? There are 2 common reasons why patients may not tolerate aspirin. One is peptic ulcer disease, and the other one could be an allergy. And then the classic other drugs to use are the P2Y12 antagonists. Now, thank goodness, there are better choices than clopidogrel, but clopidogrel, one of the issues was that if people are taking anti-ulcer medications, well, unfortunately, as a prodrug, it may fail to get activated. Anyone knows one that is not a prodrug?